Good morning, good afternoon, good evening, ladies and gentlemen, wherever you may be in the world. Welcome to Gift of Healing TV. I'm Sarah Jane, and our program this evening is Healing Chronic Pain with Dr. Wayne. So guess what? My guest is Dr. Wayne. Welcome to the program, and thank you for joining us this evening.
Thank you. Thank you so much, Sarah Jane. It's a privilege to be here.
It's a pleasure to have you here. Let me introduce you. Dr. Wayne Phimister grew up and trained to be a general practitioner in the northeast of Scotland, so more my neck of the woods than a lot of people who watch in America and Canada, etc. He has worked in Scotland and New Zealand before emigrating to Canada in 2003. Dr. Wayne is a clinical assistant professor at the University of British Columbia, author and speaker who is dedicated to finding solutions for people suffering in chronic pain. His journey into healing chronic pain includes resolving his own chronic pain 3 times and now exclusively focusing on treating chronic pain with the technique of trigger point injections, mindfulness and CBT, cognitive behavioral therapy, for those who don't understand what CBT is, and I've lost my place, there it is, anti-inflammatory nutrition advice, and the Wim Hof method to further reduce inflammation in the body. Dr. Wayne has a podcast show called 21st Century Pain Solutions, does weekly live streams, and is a TEDx speaker. He is a single dad to 3 children who inspire him to be the best person he can be in service to humanity. Whoa! Excellent. Welcome. Thank you for joining us. But I am going to start with the question. I know you've said in the bio that you've helped yourself to heal from chronic pain, but could you share a little of your journey with us, so that people can get more of a feel of how you come to do what you do?
Well, my first episode of pain was chest pain, and that came on as a teenager. And it lasted for about 6 years. And I went to my general practitioner and we did some tests and there was no real results. So I was left really scratching my head thinking, well, what is this? Every time I ran, and I love to do exercise, but every time I ran, I got chest pain. So I was on a journey at that point of discovery about medicine. I just was finishing my medical training in Aberdeen, and I looked into acupuncture and Reiki, and Rolfing was a technique that I came across, which is a deep tissue massage where the therapists massage your body every week for 10 weeks and releases the fascia in the body. And at that point, I didn't really know the role of fascia. And lo and behold, after 10 weeks, my chest pain disappeared and I was able to run. So that was a big breakthrough and a big insight into me that medicine maybe doesn't have all the answers. And my personal journey led me to the role of the connective tissue. And it wasn't until a good 20 years later in my own practice that when things changed and I realized by doing a technique called trigger point injections, and how I like to term it, advanced trigger point injections, to release this fascia, that it became a part of my one-on-one care for patients. So that was the first episode. The second was knee pain. In my late 20s, 30s, I had left knee pain. And I just put that down to, I used to like soccer as a boy, and I used to kick with my left foot. So I thought, oh, well, maybe it's just, early arthritis, age 30, old injury or old overuse with the leg. And then I went on a journey again of trying to discover, well, what can help this? And I interestingly came across something called eggshell membrane. Now, eggshell membrane is exactly what it is. Sounds like eggshell membrane. So inside your boiled egg, you've got a fine filament, which is made up of like a collagen-like material. So you can buy that at the local stores here in BC and Canada and across the US, and I'm sure you can buy it in the UK too. And it really helped my pain, so I was able to go walking, and it markedly reduced my pain. But then on a a suggestion from a patient, and this was amazing because this one patient said to me, Wayne, you should stop eating nuts. And I thought, look, this is crazy. I thought she was nuts. And I just ignored it. And then 6 months later, she said, have you stopped eating your nuts? Because she could see me rubbing my knee, my left knee. And I went, no, I haven't. So I know I quit nuts. And all of a sudden, bang, my knee pain went away. And I had no idea why. And it's like, whoa. And that was many, many years ago, maybe about 7, 8 years ago now. But later in my research around solutions for chronic pain, I came across the inflammatory cause for this condition. And, when you think about it, arthritis is inflammation of the joint. Pneumonia is an inflammatory condition of the lung, but you pick up hepatitis, inflammation of the liver. You pick any organ and you attach itis on the end, it's called inflammation. So inflammation is a part of the chronic disease spectrum. And when I came to know that food and changing what you eat, and it's a lot more to it than just nuts, but when I began to study this and realize, oh my goodness, we can change the internal processing of our organs through something called the microbiome, which is all about the gut bugs and how it interrelates with the body. So that was a radical progress for me in helping my patients. And I would say almost everybody who does this, and the more they do this, the anti-inflammatory diet approach, they have positive outcomes. And not just pain, but feeling better. The gastrointestinal symptoms like indigestion can go away, and sleep can improve, and overall health blossoms because of this approach. So that was kind of the second approach. And the third was more recently in the last year. And I got, I think it was my left foot, big toe, had an injury. So I was walking around my apartment and I kicked the door frame and I got a stub toe. It was really sore. And then interestingly, later, about 3 months later, I got pain at the side of my foot. And I thought, oh my goodness. And it was a neuropathic type pain. It was burning, it was stabbing, and it was just located at the side of my foot. And this went on for more than 3 months, hence the chronic pain diagnosis. And then I got into a state of fear because I'd already mastered pain twice before. And I thought, well, why is this here? Why can it not go away? And I really started to experience the negative thinking aspect and the mind component with this situation. So to cut a long story short, I did two main things. One was address my fear and my thoughts. And the second was go back to my heart and go back to my happy place. And a combination of heart and brain connection. Heart really connects with the brain through two different modalities, as I'm aware. And the research done at the HeartMath Institute in California for about 30 years now, and also other neuroscientists in the world, have clearly shown that when we live a life where your heart and your brain are coherent or in synchronous nature, we heal from the inside out, which is really the biggest message I have now for my patients as I talk about these 4 treatments and perform one, but talk about the other 3. And so I guess my personal journey and what I'm doing in reality with my patients go very well together.
And that's just it, isn't it? You've experienced it. You've supported yourself. And actually, so listening to you, because I was reading some of the information that you wrote for sharing about the program, and you've got, I believe healing chronic pain is a journey into yourself with awareness of mind, body, spirit connection. And so can you expand on that for those people that are maybe a little uncertain as to what mind, body, and spirit, and it is about the connection of all.
Yes, I think to explain this, we need to go back 400 years when a French philosopher called Descartes decided that modern medicine at that time should be studied with dualistic theory, which is separating things into parts. So the mind and the body. So you separate the mind and the body. And it's interesting because when you study medicine, as I did in the 80s and 90s, and even modern day medicine across the Western world, we study medicine by looking at different systems, like the cardiovascular system, say the heart and the circulation, or the respiratory system with the lungs, or the gastrointestinal system. So we learn about the body from the basic physiology and the biochemistry and the anatomy, and then we bring it up to pharmacology and then surgery and all the different domains like pathology to understand what is going on in the body. And I think it's essential to learn medicine this way, because the mind and the body and the spirit connected is what we are as human beings. But learning it is almost impossible unless you have a starting point. So the reality, though, I find, and chronic pain is a great medical condition to highlight, because it's not even a pathology. It's not something that you diagnose on a scan or a test. It's something that you experience. And the definition is literally an emotional and sensory experience of damaged tissues, or tissues that behave as though they're damaged, not even damaged. So we're dealing with an experience. So it just comes back to, well, who are we as human beings? And my personal experience with patients when I see them in the office, and when I describe this little analogy, they all understand this, like they get it. And the frustrating thing is, the medical model is about the mechanics. You know, you got a problem with the joint, so you see an orthopedic surgeon, or you take a pill for your joint, or say it's a mental health issue, so you go and see a psychiatrist or psychologist or a counselor. But nobody's trained in both. And this is the disconcerting thing, really, in modern day medicine, that this is still the norm. But the great thing is, I do see changes. I'm involved with groups here in BC that is moving forward towards this collaborative approach, not just with medicine, but other healthcare professionals like chiropractors, massage, and physio, based on the science. Because the science, neuroscience around this subject has been here for several decades now, showing that our body can heal when we start looking at these three different areas.
And it's so important for it to be the whole. I know when I've worked with clients and it's been pain that I've worked with, and the pain has gone, but sometimes the pain then actually suggests that there's a deeper underlying emotional issue to that pain. So whether the pain has been an actual physical pain, or whether it has been the emotion that has caused the pain, it's the body's way. It's the body's way of saying there's something that would like to be looked at. But I suppose inflammation is one of the biggest problems for pain, isn't it?
I think physiologically that is a main component. You know, the number one painkiller in North America is the family of drugs called the non-steroidal anti-inflammatory drugs. And there's others that can be added, COX-2 inhibitors, and other disease-modifying drugs used in, say, like rheumatoid arthritis. But inflammatory drugs are the biggest selling medication for this condition, which reflects with, inflammation in the body. And, the two modalities that I'm using these days is one, food, and two, the Wim Hof method, as you mentioned, which is all about cold exposure and breathing exercises. And, I just find that when we remove certain foods from the diet, literally what happens is you start healing your gut. And most people have some symptoms in their gut, but if not in their gut, they've got symptoms elsewhere. And when you remove these inflammatory foods, then the gut starts to heal. Something called leaky gut syndrome heals. And the genetic coding in the microbiome, which is your bacteria and your other bugs in the intestine, switches off for inflammation and on for healing inflammation. And the gut then sends signals to the brain, which then controls the whole body. And one thing that amazed me when I came across this and studied this is the intestines has this microbiome which outnumber us. So me and you, Sarah Jane, in our bodies, we've got approximately 30 trillion, that's with a T, trillion cells. Now that's a lot of cells, okay? And they all make up different organs and systems and make up us. But the bugs in there, they're so small that they are tenfold in number. So there's 30 trillion of those guys in your intestine. So it just makes sense. You know, when you think about it, so if you think of 10 fingers, one of the fingers is us and the other 9 is the bugs. Now, when you actually think of that, that's completely crazy. But that's just the state of our bodies and how it's made up. So it just makes a lot of sense. Let's eat food that helps the genetic coding of this bacteria and other bugs to help us heal. And the other approach, the Wim Hof, is all about cold exposure. And Wim Hof is a gentleman from Holland. He's got 26 world records in cold exposure. And you can easily look him up online, watch YouTube videos. But when I came across this scientific approach, his main thing is reduce inflammation in the body. And he writes about people with conditions that can literally either resolve or reduce with his approach, which in summary is when you're in the shower, you turn the temperature down a little bit. Now, that's usually okay for most people, but it freaks a lot of people out, especially myself. I didn't like the whole concept because many years ago I was doing cold showers and I got white fingers or Raynaud's phenomenon. And it kind of, put the heebie-jeebies in me and thought, I'm not doing that. But as I listened to my patients who were doing it and I looked into the science, I thought, there's something in this. But when you have a cooler shower or a cold shower, what happens amazingly is you stimulate your brown fat. Now, brown fat is half of the fat in the body. You got white fat and brown fat. White fat is the adipose tissue that's very difficult to mobilize, difficult to get rid of, especially if you're increasing in age, no matter what you're doing with food and diet. And but when you stimulate your brown fat with cold, you burn energy and your core temperature rises. And as a result, you don't feel the cold as much. And as the more you practice, the easier it gets. So the cold stimulates energy. And not only that, you reduce inflammation. You can sleep better. You feel better. You get endorphin buzz. And general health can improve. And the other approach is the oxygen or the breathing exercises where you breathe in 30 times, one through your lower lungs, one through your middle lungs, to the side of your ribs, and then the third is through the upper lungs. So you breathe in and just let it go. And then the middle part of the lungs, allow your ribs to expand to the side and let it go. And then the upper lungs, which is way more easy. So these are 3 simple breaths. You do it 10 times, so that's 30 breaths. And then after that, you exhale and hold your breath as long as you can. And after a while, maybe 20 seconds, 30 or 40 or more, your carbon dioxide level will rise and all of a sudden you will have to breathe, because if you don't breathe, you're in trouble. So you'll take a deep breath in and then you relax and just enjoy the relaxation process. So you repeat that according to Wim Hof 3 times and do it 3 times a day if you've got the time. So both the combination of utilizing energy and increasing the blood flow, because that's what the cold does as well on the skin. It increases the blood flow to the areas you need for better circulation and therefore the tissues that are in pain. And then also we improve the oxygenation and the function of oxygen in the cell. And all of this is essential when you come down to the core level of really what is going on in the nervous system to cause this pain experience in the first place. So as you said, inflammation is really important. And these are 2, one is very easy to do, one is more challenging to implement diet change, but both are effective, I think. And I'm finding with myself as well as my patients in helping their journey with their pain and condition.
Excellent. Yeah, no, I'm the minute I read the Wim Hof, I thought, I know what that is. And then when you said about the cold, I thought, yes, I remember seeing things on that and sort of going for these cold swims and just sitting in cold water, ice cold water, sort of in places like the Arctic and whatever. And it was just like, yeah, right. Don't know whether I could do that, but but it's what you get used to, isn't it? It's what your body has to get used to anything. But I'd like to go back to the food thing, because I mean, I know with our own family, we've got celiac and sort of gluten intolerances, etc., within different members of the family. And so is it just specific foods, or is it a matter of it's different for everybody to a degree?
Yeah, it's a really good question. The science behind this was pioneered by Stephen Gundry in California, and he looked at 10,000 patients, and it was over 10 years, and he measured cytokine levels, which are very specific markers for inflammation in the body. And he was measuring this as people remove food and then introduce food back into their diet. So he found a list of foods that you can find online called the yes list, no list. If you look at the Plant Paradox, which is the name of his book, and you get a list of foods, yes foods you eat them, and no foods you don't eat those. So the practicality of this is, and I've talked to several, my podcast show, naturopathic physicians and other therapists who have implemented this into their life. And I've got slightly different opinions from different people, which is great, because it's important to get a well-rounded approach. But the biggest two would be cow milk, and that's here in North America and in Europe, in Northern Europe, so where you guys are. Southern Europe's different. And it's interesting to say this because it's the protein called casein A2 in the Southern Europe cows, and this is a protein in the milk that doesn't have the inflammatory protein. Whereas in Northern Europe, as well as Northern America, the protein is casein A1, which is inflammatory. So a simple thing is to not drink milk or replace it with alternatives like almond milk. That'll be the first thing. The second thing is gluten. Now, you mentioned celiac, and it's a very important subject because if you do lab tests, it's approximately 1%, if not less, of the population in the Western world has got celiac. But when we have proteins that are causing inflammation, they are causing an upset in our body. And we're maybe negative to the celiac test, but we still have insensitivity. So the easy thing to do is not to eat bread. Now, that's maybe practically not going to happen. But something like sourdough bread is the best if it's good quality, because they take the grain, the wheat grain, and they ferment it before they prepare it. So by the fermentation process, you change the grain, and therefore you change the inflammatory load in the body. And for many people, that's perfectly fine. So those are two big ones. Other big ones, eggs, if it's not free range, corn, soya. So these are kind of the five, if you want to pick the top five. But in all honesty, if you want to do this, my tip would be to look at that list, see what you can change, move from the no list to the yes list, and do it for 4 to 6 weeks. And if you can do it for 4 to 6 weeks, your body will change, your microbiome will change, and you will feel different. And you'll feel way better. Energy will improve, gut issues will resolve, and several other health things will change in your body. And then after that, you reintroduce some foods. For example, the classic is, rice. Many people eat rices, many cultures eat rice. But Indian white basmati, if you cook it and then chill it completely in the fridge and then reheat it, you lessen the starch load, the resistant starches. And therefore, it's got less inflammatory load in the body, less effect, and therefore is more easily tolerated. And it's about this personal journey we talked about. You've got to find what's right for you. And it won't be the same for everybody, not by a long shot. So it's just you do what the body says. Maybe you want to have a pizza one night and you feel a bit bloated for a couple of hours. Well, that's fine, right? But if you maybe have gluten-free pizza, which doesn't completely deal with inflammatory proteins, but it's better for this inflammatory load idea, then you might be fine with that. So it's a personal journey, and let your body communicate. The body is communicating to us all the time, and we need to listen to its intelligence and act accordingly. And food's a great way to enter into that level of awareness and self-discovery on this journey.
And absolutely the food thing, I think maybe because of a couple of things that happened to me as a child, one being hospitalized so young and being fed food I really didn't like. And apparently my parents have said there's a story where there was a horrible little nurse and I spat my food back in her face. Had everybody in stitches except for the poor nurse. But I was only a year old, so I think I could be forgiven for that one. But, you know, sort of, yes, I am so fussy about food, but I also drank paint stripper as a young child, which then meant my stomach had to be pumped out. And there's the possibility that didn't have a particularly good effect on my taste buds. So yeah, I was a bit of a handful by the sounds of it. I got into a cupboard nobody could open. So it was, but you know, it's very difficult. I get the dowsing pendulum out and I will ask my body, is this, and my body has said no to milk. I can have it very, very occasionally, a little bit in a cup of tea out, but I don't drink that sort of tea at home. As I said, family member, my youngest sister is full-blown celiac and she's intolerant to dairy. My mother's intolerant to wheat, to gluten. Other members of the family have got intolerances to it. So it's actually quite prevalent in our family. But yeah, I think it's really important that we look at it and we ask our bodies, and people's got to find a different way of that. As I said, I like to douse, so I will actually douse. I can douse using my actual body, or I get a pendulum out and ask. And soy, I was using soy instead of meat, and then it was just like, actually, I'm not feeling really well, particularly well after this. And so and it was just like, no, don't you dare. You know, it was just, so it is the listening. We think we're doing the healthy thing. And then we find, but nuts, what is it in particular in nuts that doesn't work with inflammation? Because, or is that just particularly for some people and not necessarily for others?
Well, nuts on a whole are a great food, and I eat them almost every day. But the two that cause the inflammatory reaction is peanuts and cashews.
Right.
So the rest, the walnuts are probably the best from this perspective because it's got butyric acid, and it's a real important stimulant for the microbiome, and like food for the microbiome. So that would be my little tip on that. Excellent.
No, because I love my walnuts. I'm a great one for walnuts, but I do like peanuts as well, but not the salted variety. Although I do like those, but sort of. And it's also looking, I suppose, where you get the food from, because unfortunately, wheat and soy are two of the worst for being genetically modified, aren't they? Which also doesn't particularly help.
Mm-hmm.
So other thing, you talked about the injections. So what are they?
Trigger point injections. If you go online and you Google trigger point injections, what you're going to likely see is an injection of a solution, maybe lidocaine or a combination, maybe lidocaine and a steroid like cortisone, into a taut muscle band called a trigger point. And that releases the taut band and relaxes the muscle, and people feel better. So that's the traditional approach. And what I do is I take that into consideration, but I also deal with fascia, because the fascial tissue in the body is this strong structural component that's around your muscle. It's through your muscle, and it connects all muscles to muscles. And it literally runs from your head to your toes. And it's the constituent of your ligaments and your tendons and the joint capsules, and also supports your organs, and they go around your organs. So this structure, I find, in my experience, thickens and tightens with pain and in the pain presentation, because tightness goes along with the pain experience. So I take my needle and I go in and out very quickly. A 1 drop of lidocaine, 1% is what I use, just a local anesthetic. And that is enough to start creating a little hole in the fascial plane. And you do multiple injections, different locations. But it's not just, say, in a neck region, say you've got left neck pain, but maybe there's tightness in the right lower back. So by treating the neck and the mid and the lower back, and maybe the gluteal region, then you're treating the whole area. And my personal approach is you've got to treat the areas, all the areas that are tight, as well as the areas that are in pain. So that's what I do. I see people once a week for 6 weeks. And as we relax this tissue, then the blood flow can improve to it. And we get that oxygen back. We get those nutrients. We talked about the Wim Hof method. We talked about anti-inflammatory action. Well, these two things will help the healing in addition to this trigger point injection technique. So that's what I've been doing for many years now. And there's a newer technique that I've recently introduced, and it actually deals with the chronic inflammation in these fascial planes. And this is really for maybe 10% of my, 10, 15, 20% of my patients who are not responding to the classic release fascia, release muscle nods. But when those tissues are really stuck down, say you got a frozen shoulder, for example, you can hardly move it, and the injection, maybe your doctor's tried, like cortisone, is not working. But the reason is all the fascial plane through the muscle, around the muscle, is like glued. It's literally glued. And when you inject into these tissues with a combination of saline or salt solution with lidocaine in a 5-to-1 ratio, and up to about 5 mils, it's quite a lot of fluid. It's a lot more than one drop. 5 mils in each injection site. And then I also use about 4 milligrams of depomedrone, which is a steroid. And that's a tiny dose. It's a tenth of the overall dose you would use as a family doctor injecting somebody's knee. So a tenth of the dose in a total of all those injections. So maybe there's 6 or 10 injections in the shoulder. And as you go in, you inject the fluid, it goes under the skin first, and it tents up like a tent. And then as you advance the needle down, the fluid literally flows down the pathway that the needle's been and enters the layers. So this is a layer here, and then this will be a layer, and then this will be a layer. There could be 2 or 3 layers. And the fluid finds its way into this chronic stuck down state, and it opens it up, and it irrigates it, and it hydrates it, and it also detoxifies because it takes away the chronic inflammatory cells in these layers off into the kidney, and you pee out the waste products. And what happens is the body starts to remember what it was like to have a joint that can move again. Yeah. And it's quite miraculous for many patients when they've had years and years and years of sore backs or multiple failed therapies. And that's generally who I see on a daily basis. People who've tried many things and it hasn't worked. But even the regular trigger point or the fascial release trigger point that I do every day, even when that doesn't work, this new technique is very promising, and I'm finding lots of great results with it. So that's a summary of what I do in the office.
No, and it's excellent. So really, we could do with doing preventative, all of us, couldn't we, at the end of the day, thinking about it all. From the what we eat and how comfortable and uncomfortable we are after what we've eaten, to exercise, to stretching, to breathing, and this is something my youngest sister, she came down with the COVID-19, and I said she hadn't been going out. She hadn't been going out on a daily basis, getting fresh air. It's something I do. I go out for a couple of walks every day. Got a local wood. I try to get into it at least once a day, because you're breathing good, clean, fresh air in the woods, running there in the daytime. And she hadn't been doing that. And I do wonder, those people who are coping better with the situation, are those people, and those people that don't get ill, don't get too much in the way of inflammation, etc., are those people that look for the mind, body, and then we look at the spirit side of things as well. The mind, but then there's the gut mind connection. And they're starting to call the gut the first brain or the second brain.
It's probably the main brain.
Because they have discovered there is a really, really important connection between the two, to really support our health.
Mm.
So
Yeah, let's talk about that a little bit, because we've talked about the gut quite a lot. But let's talk about the brain and the mind, because this is where the science is to back up the whole people can heal from their chronic pain. And it's important to understand some basic principles. The first would be, most of us are living in a fight-flight situation, the survival response.
Yeah.
And if you can just think, there's in a dangerous situation, you're driving your car, and all of a sudden there's an animal jumps out in front of your car, and you put on the brakes, and you get the deer in headlights sort of look on your face. Your body's in fight flight, and we can all understand that. But the reality of our busy life, where we get up in the morning, we go till the time we go to bed at night, we don't even stop and think. We're just in automatic mode. That is a fight flight response. So unless we deal with that, then we can't actually heal, because we're meant to be surviving, not thriving. And we need to realize that in that fight flight, there's adrenaline and cortisol. And there's also, these are hormones, and there's also neurotransmitters. And it's really interesting when you look at the subject of epigenetics, and which says your environment shapes your DNA. And we've all had experiences our entire life. Some are great, some are less great, but they're all shaping us. Because we now know from the science is that when we have external environments stimulating our thoughts and our emotion, they literally create peptides in the brain, which are information molecules or proteins that then go into the blood and around your body. And in the blood system, they're taken to every cell, and they're taken up into the cell, just like oxygen is. And inside the cell, they're programming the DNA. And that DNA is an expression that leads to a function. And the function multiplied by 30 trillion cells is me and you right this moment. And the reality is we live in a life that's based on memory, and we live in these thoughts. We live with emotions. And most of us don't know this, because 95% of our waking state is subconscious. What are you thinking? What are your beliefs? Your emotions come up to the surface and they communicate. It's like the language of the body. But then the memories, if something's negative's happening in your life, the automatic thought is go back to the negative experience. So we're literally wiring ourselves. The common saying is, what fires together wires together. So we're firing off these neurons in our brain, which has been conditioned from childhood, even childbirth. And as a result, we're in the state, and it's the reason why about 20% of the population in the Western world has got chronic pain. So the question is, well, how do we get out of that state? And, I think the simple thing, and it's not simple, and it's a challenge, but is to sit and just be aware of what are you thinking and what are you feeling. If you were to jot down 3 or 4 things, thoughts and emotions, and just sit with them and face it and say, I'm not getting off this chair until I sit through this experience. And it's interesting, because if you do this enough, then you're going to start to see patterns of thoughts, patterns of emotion. And the more we can be still and present, we literally get more energy. Because being in a fight-flight response is extremely energy draining. That's why fibromyalgia has got chronic fatigue attached to it, because it tires us out, depleting our energy source, any energy resources. So when we are more present, and the starting point is to look at what the problems are, and you'll easily know because you've got thoughts all the time and emotions all the time. And when you start to look at that and embrace it and start to choose a different thought, whatever it may be, and you keep doing this and keep doing this, what happens is the thoughts then change the chemistry, those neurotransmitters and those hormones in our body. And all of a sudden, this chemical soup of chemistry starts to help us. We have different feelings, different emotions, which then goes and changes the brain and rewires it. And then you start to have a different experience. And one of the really important things to get here, and a very simple, short little chat, is when we're there and we've got more energy, say you're more focused, you go to your heart. Put your hand over your heart, just touch your heart, because then your thinking mind will think of the chest because your hand's there. But if you start to reflect on positive experiences, and even though you're struggling with pain, you can be grateful for the positive things in your life. And there are many, 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 many things that are positive in everybody's life. You've got 10 fingers and 10 toes to start with. Without them, we know there's a problem. And there's many, many things that we can be grateful for. But starting in a place of gratitude, what happens? And this has been shown scientifically, that your heart connects with your brain. And inside the body, there's the vagal nerve that goes up from the heart up to the brain and connects it. But the science also shows the electromagnetic connection between the heart. And this ties in with the work that you do with Reiki. The heart and the brain are connected through electromagnetics. And the simple way to prove that is anybody who's had a child or a very loving animal in their life, you just feel connected to it. And that feeling that you get can be shared in the room. If you're with family members you love, it feels good. If you're in a room with the enemy, your enemies, it doesn't feel too good. Why? Because of the electromagnetic nature of ourself and also life. So when we can spend time in our heart space, and being grateful through our day is the simplest way to do this, but also in the morning when you start, or in the evening when you start, being more present, facing the fears, embracing what is going on in your mind, connecting the heart, our bodies go through a transformation. And you get something called oxytocin. It's a hormone. And there's something that I recently read up on it, it's something called endothelial-derived relaxation factor. So it's a chemical in the body that you literally relax your blood vessels. You get more blood flow. And we all know for feeling good about something, it feels good, right? And it's like the chemistry has changed. And the more we do this, the more we can connect with this on the personal journey with our pain, the more the brain will change, and the more we're going to move to a different language, literally a language in the body, and the pain signals can start to go down. The signals are still there. The programming's still there from the past, but we can transform it with what you think and what you do. Because what you do and think right now will determine your future. And the amazing thing with this is, the more you practice this, feeling good, is you're giving your signal to your brain how it's going to be. And all top athletes in the world know this. They go over their events in their head many, many times. They practice. So by the time they get to that, national championship or Olympic Games or whatever it may be, they've won the race in their head, or they've run the perfect 100-meter run or marathon, whatever it may be. They've already done it. So they're setting themselves up for success because they've taken the time to prepare. And we're all in this thing called life, and we're all have the present moment. The past is dictated from the past to the current moment, but the present moment dictates the future. Yeah. And the more we can live in the present moment through our day, we change and we heal.
It's about helping ourselves to get out of our own way. Very simply put. And I suppose loving yourself. When you can be comfortable and have that energy, you said the love of a child, the love of an animal, but actually, first and foremost, having that love for ourselves, because then we will take care of ourselves. Plus the fact, for me, having learnt to love myself, there is that that peace, that being able to relax, that not getting so frustrated, so angry, so fearful, so all those negative words and feelings. And when they come up, being able to actually say, okay, fine, I can face you.
Yes, exactly.
That's what it is all about. But we're not taught, we're not encouraged to love ourselves. Although, having said that, there is so much more of that coming out now. Oh, we are very, very close. Well, we are at the end, but we've had a great conversation. Thank you. Is there anything more that I'm sure there's loads we could talk about, but is there anything more you feel you would like to share before we wind this up?
Yeah, I think, on this personal journey, it's important to think outside of ourselves as well. And I mentioned it in what I said just a minute ago, but the relationships we have, my life has completely changed in the last 12 months. And my real appreciation for my loved ones, for my children, for my parents, for my sisters, and also for my beloved country, where I come from. And also the role, as you said, get outside and be in nature, because nature has a healing energy of its own. And when we hang out there and get out there, we just feel better. So just to remember, relationships and environment create what this internal environment can be. And we need to take charge of this inside, but we also need to be proactive on the external side and optimize that so that the combination of external and internal mix and therefore help us on this personal journey.
Excellent. Thank you so much indeed. I want to go back to one thing very quickly. You talked about the two levels of yes, no of food.
Yes.
The two lists. Where can people find those? How's the best way to look that up?
If you just search engine plant paradox,
engine plant paradox.
No, just plant paradox. It's the book, the plant paradox. So, Google, Yahoo, whatever you're using. So plant paradox, and then yes list, no list.
Yeah.
You'll find the list, and it's a good starting point. There's a lot to this subject. We take a whole hour to talk about it a bit more, but yeah, it's a great starting point to start listening to this body of ours so we can move forward and help us heal.
Excellent. Excellent. Thank you so much for sharing. Your website is, no, I haven't got that. Why haven't I got that there? What is your website, Wayne?
It's my name. It's Wayne Phimister. So WAYNE, P for Patrick, HIM for mother, ISTER.com. And on there's lots of resources and links to webinars and my TEDx talk and my book.
So folks, do check that out, and I will put that under the YouTube video. So if you're watching it on YouTube, then it's going to be under the video for you to find, and I will check out and see if I can find that link to the list as well.
I think there's one thing else just to finish is, as we've been talking about this personal journey, I live stream at 7 p.m. Pacific time, so that's very early in the morning in the UK. But the recordings are on there for the rest of the day, and it is a one-on-one or week-by-week expression and discussion. My hope it becomes a discussion of this personal journey, because we're all on it. Yeah. So more up-to-date information as I go forward, and learning not just about health as we're talking about today, but other aspects of life. Lots and lots of things that we're involved with and different systems that we're involved with. We're all on a journey within it, and we all need to discover more about it. And I think sharing that from the heart is the way forward.
Oh, absolutely. It's why I do these. It's why so many of us do what we do. The sharing aspect is really, really important. And so, folks, if you're watching this, whether it's live, whether it's the recording, whether it's on YouTube, if there's something that's really spoken to you, but even if there isn't, is there a member of your family that could actually benefit from this? Share it. This is why we do it. It's no charge for watching this. It's just there, and that is why we do it. So Wayne, thank you so much for joining me. It's been an absolute pleasure. Thank you for all the great information. And folks, I hope you will go and check out Wayne's website as well. Next week, I've got a thoughtful nuggets and pearls for you. The first step to healing. And we'll leave it at that one. I hope you will join us again then. Wayne, thank you. We are going to be cut off the minute I close this down. And I'll send you the link to the recording tomorrow. Thank you so much for joining. Thank you, folks. Love, peace, and light to you all. Stay safe. Be careful. Stay well. I'll see you all again soon. Bye.